Breaststroke is a style of swimming in which your anterior torso faces the bottom of the pool while your arms move in parallel syncopation, breaking the surface of the water while your legs mimic a frog kicking pattern under the surface. The goal of the breaststroke is to drive the body forward through the water in the quickest amount of time possible. The breaststroke is one of the 4 competitive swimming strokes. However, it is known as the slowest of the 4 because it requires the most force and strength as compared to the other 3 strokes.
In this video, we will demonstrate using certain biomechanical principles how to increase proficiency in the breaststroke in order to gain speed. Increasing in proficiency can be done by making opposing forces to propel you forward instead of deeper into the water. This is demonstrated by Newton's third law, in which every action has an equal and opposite reaction. For example, massaging your hands down will push your body up, while curving hands out and back will push you forward. When coming up for air, you should not raise too high out of the water. Air resistance will slow you down and can lead to more energy expenditure. There are also ways to increase speed just by changing what you are wearing. By using a compression suit and a swim cap, the drag force will be decreased and you will be able to increase in velocity. Male and female swimmers will shave their body to remove hair and decrease drag force as well. You can also use an open turn from the wall to increase explosive speed to go in the other direction, rather than just turning around. In doing this type of flip turn, you are effectively avoiding the wave made while swimming in the first direction. Archimedes' principle states that for any body completely or partially submerged in water will experience a buoyant force equal to the weight they displace. Due to this, and the fact that humans are actually less dense than water, swimmers must work extra hard to counteract the inevitable floating that will occur.
In this clip, our swimmer demonstrates a proficient breaststroke. As she completes her stroke, her anterior torso faces the bottom of the pool as she pulls her arms through the water parallel to the surface. She avoids bringing her arms down through the water to maximize her forward propulsion. With each syncopated stroke, her palms turn outward to maximize the surface area of her hand in order to move more water, which increases her distance. She then glides her hands through the water to pull them back in front of her, with her palms facing each other. Doing so changes the angle of her hands to minimize resistance as she pushes them back in front of her. Her knees flex and extend at the same time her arms do. This coordination allows the swimmer to generate a maximum amount of force to push her forward at one time. She keeps her body relatively parallel to the surface, including her legs, to avoid sinking into the water. When she raises her head out of the water for air, the swimmer does so between strokes and only rises minimally above the surface. Here, the hand technique of the stroke can be clearly seen. Our swimmer also completes a breaststroke flip turn, which allows her to change her direction in the lane while sacrificing as little time and momentum as possible. This propels her forward with speed as she glides through the water and resurfaces to start the breaststroke again. 2 mistakes, which are commonly demonstrated in breaststrokes with poor form, can be called massaging the water and narrow pull into the body. Massaging the water is described as when a swimmer's hands enter the water with their palms down and parallel to the surface of the water. This is bad form because pushing the palms flat into the water requires more force to break the surface tension of the water, as opposed to entering the hands at an angle. This requires more energy and makes the motion less efficient. A narrow pull into the body is described as when swimmers pull their arms directly down into the water and toward their body. This motion propels them up toward the surface. If they instead push the water out of the way by pulling their arms in an arc toward their hips, they would be propelled forward as they minimize the amount of lift force performed on them. The swimmer should aim to keep their body as horizontal as possible in the water. In this clip, the swimmer demonstrates poor form. Instead of pulling her arms back parallel to her side, she pulls them straight down below her, thus demonstrating the narrow pull form. This movement pushes her body farther up out of the water than is necessary, which ultimately slows her down. She is also not wearing a swim cap and is wearing shorts. Both of these factors increase the drag forces she experiences.
A study done in the Medicine and Science in Sports and Exercise journal shows that utilizing a compression or triathlon wetsuit can help reduce drag force by 12 to 14%. This reduction in drag can help swimmers afford a higher velocity while swimming. Another study done by Sharp and coast still demonstrates the effect of shaving on swim speed. Those that removed their body hair experienced a lower drag force and not only increased their volume but also expended less energy while swimming due to the removal of dead skin cells. Many physical and occupational therapists use swimming or underwater exercise for rehabilitation. Since you experience less gravity while underwater, there is less pressure on joints, which can benefit those with arthritis. It is also considered to be better for cardiovascular patients due to the decreased effort required by the heart.